Hello and welcome to today's ICNTD Connector webinar. My name is Marianne Comperet and I'm speaking from the International Society for Neglected Tropical Diseases. We're thrilled today to be tackling discussions and having a great presentation about yet another highly neglected disease, in fact a zoonotic disease in this case. And we will be talking today about cystic echinococcosis with a focus in the Eastern Mediterranean region. And it's equally our pleasure today to welcome Professor Majid Fasihi Harandi, who is director of the Research Center for Hydatid Disease in Iran, and is also a professor of molecular parasitology at the School of Medicine of the Kerman University of Medical Sciences, also in Iran. So Professor Harandi, a very warm welcome to today's ICNTD Connect webinar. I hope you are well.
Thank you very much, Marian, and thank you so much for having me. And let me talk about the cystic echinococcosis.
It's our pleasure, and one of the reasons that we thought it would be great to talk about this today was that recently you co-authored a paper which was published in PLOS NTDs and really focusing on the fact that cystic echinococcosis is prevalent in the Eastern Mediterranean region and yet remains highly neglected. So we'd love to hear more about your research and your thoughts on this, and hopefully after your presentation this will open up to a lively Q&A and discussion. We have a lot of veterinarians in our audience today, and again a very international audience. So to our attendees, very warm hello. And Professor Harandi, I will hand over now to you and for your presentation, and I look forward to having some discussions following this in a few moments.
Okay, thank you, and good time to everybody. Good evening, good afternoon, good morning, everybody. Let me start. As Marian pointed out, I'm going to talk about cystic echinococcosis with a special emphasis on the Eastern Mediterranean region. So what I'm going to talk about is the first, what is cystic echinococcosis? Where is the Eastern Mediterranean region? Why CE is prevailing in the region and why it is neglected. So let's start with the disease first. Echinococcosis is actually two different diseases with very similar life cycle and biology. One of them causes a fatal infection, but more or less rare in the region, and all over the world. It's called alveolar echinococcosis, caused by the Echinococcus multilacularis. It's mostly cycled between rodents at intermediate hosts and foxes and other carnivores as the definitive host. But one of the other forms of echinococcosis which I am going to talk about today is cystic echinococcosis, which is very far more widespread than alveolar echinococcosis. It has a domestic life cycle between dogs and livestock, domestic animals like sheep, goat, cattle, camel, pigs, and wild ungulates. And as you see here, the definitive host is a carnivore, and a small tapeworm called Echinococcus granulosus lives in the small intestine of dogs. And when dogs defecate, the eggs of the parasite disperse in the environment, and it could infect people as well as the animals. The result is a cystic mass, a cystic lesion in the viscera of the intermediate host, which is mostly in liver and lungs, and virtually every organ you think about it, in the brain, in the spleen, in bones, breasts, endocrine system, the heart, and virtually every site of the body could be involved in the disease. As you see here, a cystic lesion, you can see several cystic lesions on the liver and lungs of these sheep organs. The same is happened in human as well. So you can see here a human spleen with a huge cyst. We have recently collected in our medical center, Afzalipur Medical Center, and this is for cattle, several cystic lesions in cattle or in the liver. Okay, as you can see here, it's a real zoonosis with carnivores, domestic and wild carnivores as the definitive hosts, and several species of domestic and wild ungulates as the intermediate hosts. So it's a zoonosis, and we are talking about this zoonosis as a neglected disease. Regarding the significance of cystic echinococcosis, you know, C is assumed to be a human and veterinary public health problem, but there are very limited data for the global burden of disease, and the socioeconomic impact of the disease is not fully understood in the region and in many other endemic areas in the world. For example, in the Eastern Mediterranean region, a couple of studies have been carried out, one of them in Iran, as you see here, and it's estimated that the monetary burden of the disease only in Iran is more than $200 million every year. So it's a huge burden on the society. According to WHO, it's estimated that more than 1 million people are suffering or affected with the disease in any one time. Mostly the disease is prevalent in rural areas, but we could see the disease in urban areas as well. Many of our patients around the region are from urban areas. And the cost is estimated at $3 billion annually. So let's have a brief talk about the region. Where is the Eastern Mediterranean region? As you see, this region is consisted of 22 countries, mostly in the Middle East and North Africa. It's sometimes called MENA region, Middle East and North Africa, from Pakistan and Afghanistan in the east to Morocco in the westernmost side of the region. So about more than 600 million people living in this region. WHO has 6 regional offices around the world, and one of the regional offices in WHO is the Eastern Mediterranean region. It's called EMRO, Eastern Mediterranean Regional Office. As you see here, it's the same area as I have shown to you in the previous slide. Regarding the climate, it's a variety of climate could be seen in the region, from a warm desert climate to the humid Mediterranean climate, here, yellow areas, and to the temperate continental climate in the northern parts of the region. This is the distribution of the disease around the world. You can see the heavy green areas, which is the areas where cystic echinococcosis is highly endemic. As you see, all of the Eastern Mediterranean region are highly endemic areas for cystic echinococcosis. And for the white ones, I think there is no data. If we go through the populations here, we can find the disease here as well. So another disease, alveolar echinococcosis, caused by Echinococcus multilocularis. You can see here both disease in some area. Both diseases are occurred in China, mostly in Central Asia, in northern Iran and Turkey. So one of the most important hotspots of the disease is Eastern Mediterranean region here. It also affects Southern Europe and also Sub-Saharan African countries. In South America, especially in Argentina, parts of Brazil, Uruguay, Chile, Peru, it is a prevalent and endemic disease. So it has a global distribution in the world. The question is why cystic echinococcosis is prevailing in the Eastern Mediterranean region. So our third question, and one of the most important questions, is why the disease is so endemic and so prevalent here in this region. One of the causes of this is the geography and the ancient civilizations in the region. If you see to the Eastern Mediterranean region, first people who domesticated animals, for example, sheep, cattle, goats, pig, on the earth are people living in the Mediterranean basin. According to a paper published by Melinda Zeder in PNAS, as you can see here, the first domestication occurred in this region, in the so-called Fertile Crescent. About 11,000 years ago, people domesticated goats and pigs and cattle and sheep here in the Eastern Mediterranean region, in Iran, in Mesopotamia, in Iraq, in Syria, southern Turkey, Lebanon, Egypt, Palestine, and Jordan, and other countries. So the Fertile Crescent is the cradle of a domestic transmission of the disease from more than 10,000 years ago. But we know the wild transmission, the sylvatic transmission of the disease has occurred several million years for, I think so. Okay. Another answer to this question is the diverse intermediate host species in the region. So it's estimated that more than 13 different intermediate host species could be infected in the region. All kinds of livestock, from sheep, goat, cattle to buffalo, horse, donkey, camel, and both one-hump, two-hump camel, pigs, and several species of wild ungulates could be infected in the region. No region on the world has so diverse intermediate host species. So that's why we could see the transmission of the disease here. We know that the cystic echinococcosis is transmitting to all 22 countries in the region, all 22 countries. But for sure, the most important intermediate hosts are sheep, goat, and camels, and to a little extent cattle and pigs as well. But the most important ones are three animals: sheep, goat, and camels in the region. Another important issue is the availability of intermediate host offal to dogs. If you have a look on the cycle, cystic echinococcosis cycle, you can see that dogs have to be infected with the parasite through ingesting viscera of the intermediate hosts, which is the sheep's and goats' livers, lungs, and other organs. And the dogs have to be, and the viscera organs have to be available to the dogs as well. So when we look in the region, we can see many abattoirs which are not so standard. Many abattoirs are substandard abattoirs, and the offal could be available to the free-roaming dogs. We can find free-roaming dogs, many animals around the abattoir, around the slaughterhouses in the region, like many endemic areas in the world. Another issue is home slaughter and illegal abattoirs, because most countries of the region have veterinary inspectors in the official abattoirs. But the problem is, in several countries, people practice home slaughter in rural areas, and there are illegal, unofficial, unregulated abattoirs in the cities, which they have no veterinary inspection, and so the viscera of the infected livestock will be available to dogs in the region. As you see here, for example, the animals kept here and then slaughtered, and the infected organ will be disposed here, and dogs are around and could eat the viscera, as you see here. It's another one, and dogs are waiting for the viscera on the afternoon to ingest and infected with the parasite. Another issue is free-roaming dog population is the big issue. And as you know, in many developing countries, it's a problem. Free-roaming dogs with no checkups, and they are roaming freely in the cities and in the rural areas, and many of them are infected with the parasite and excreting the eggs through their feces. So this is a major issue which facilitates the transmission of the disease. As you see here, in the cities and in rural areas, free-roaming dogs are everywhere, and people could be infected even in the urban areas. And there is a task for us, for veterinarians, for public health officials, to do something about dog population management. And we have good guidelines here. We have to observe these guidelines. For example, this ICAM guideline about humane dog population management guidance. It's theoretically possible, but in action, it's very hard to do in many endemic areas. Another issue which could facilitate the transmission of the disease in the region is many social, cultural events that intensify the cystic echinococcosis transmission in the region. For example, in social events like weddings, like funeral services, like mourning, religious ceremonies, and in mass gathering of Hajj also, in Eid al-Adha, which is an important festival in many Muslim countries in the region. Several thousands, several hundred thousands of livestock will be slaughtered, and many of them in unregulated slaughterhouses or at home. So this is a major issue in the transmission of the disease. Another issue is the close human-dog relationship. So dogs is the oldest friend of a human from more than 15,000 years ago. So this close contact could facilitate the transmission. As you see here, it could be a professional contact. For example, this herd shepherd with the herd dog, with sheep dogs, and also people, especially children, have a close contact with dogs, and they could be infected. And the thing is, the incubation period of the disease is a little bit long, maybe years. So children could be infected right now and develop the cyst several years later. Another issue is food habits. In the Mediterranean region, people prefer to use fresh, natural vegetable products, and this make them more susceptible to the transmission. Raw vegetable consumption in the region is very high. For example, as you see to FAO data, as you see, the yellow one is the average world consumption, per capita consumption of vegetables, and the other three columns are for Egypt, Iran, and Turkey. As you see, they consume high amount of raw vegetables in their diet. And if we look at the agricultural system, you see that the farming system is very open, and dogs could access the farms and crops, and the crops could be infected, and when people uses fresh unwashed vegetables, they could be infected. In addition to the traditional agricultural system, we have traditional animal husbandry system. In many areas, there are nomadic people with animals, especially dogs and sheep around them, living with them and transferring them, traveling around the country. Echinococcosis in the wildlife is really important. You know, the disease could be perpetuate in the wildlife between wolves and wild ungulates, and the reports indicate that the sylvatic transmission of the disease has been occurring in every country that they research. Another issue is the different genotypes. This region is also very rich in the genotypes, different genotypes of echinococcus. As you see, there are 10 genotypes, G1 to G10, and most countries have several genotypes in each country. We could see in Iran, Iraq, Jordan, Oman. Many countries have no record because, for example, in the Arabian Peninsula, we have not enough data. More and more data are coming in, but we need more research and more data from these countries in the Arabian Peninsula, from Afghanistan, from Pakistan, and Lebanon, Jordan. We have no recent data on echinococcosis from here because it's just a neglected area of research. So you can see, if we have to control the disease, we have to cut the cycle in different sites. For example, we have to correct our slaughterhouses, we have to control home slaughter, we have to control feeding dogs with viscera and improving our slaughter hygiene, culling aged sheep vaccination with EG95 vaccine, and educational campaigns, multidisciplinary activities are needed to control the disease. That's why the disease control, CE control, is very complex. So the final question is why CE is neglected? One of the main reasons is the global burden of all disease. If you see here, this is from IHME Global Burden of Disease. The blue area are non-communicable diseases. These are the physical damage and accidents and other causes of death. And this area is the infectious and communicable and neonatal diseases. As you see here, at the global scale, this area is a little bit smaller than other areas, and the neglected diseases are here in this small box. So 17 diseases are in this small box here. It's at the global scale. If you see, for example, sub-Saharan Africa, you see here, the communicable disease is so bigger than other boxes here. And that's why the disease are neglected. Here, for example, in a country at the global scale, and this is the sub-Saharan African country. If you compare these two boxes, you see that the most research, most funds, most attention are towards the non-communicable diseases and big three here. Big three means HIV, malaria, and tuberculosis. If you see here, the big three of infectious diseases, communicable diseases are HIV/AIDS, malaria, and tuberculosis, TB. So this is one possible explanation of the neglected situation of this kind of diseases here. Why CE is neglected? One of the most important causes of the neglect is lack of information and awareness about the extent of the problem. We really don't know of the disease in many endemic areas in the world. In many EMRO countries, little is known about CE epidemiology and transmission. In many of them, recent data are not available. There are limited data for estimating the global burden of CE. And the result is the socioeconomic impact of CE is not fully understood. We could explain the neglected situation of disease at three levels: at the global level, at the national level, and at the community level. At the global level, as you know, neglected tropical diseases do not travel easily, and thus they don't pose an immediate threat to the rest of the world. It's one important cause. They are tied to a specific ecological, geographical, and environmental condition, as you see in the Eastern Mediterranean. The ecology of the region is very suitable for disease transmission. And the third is the development of new diagnostic and preventive tools has been underfunded just because they do not represent a significant market. So many pharmaceutical industries cannot invest on this disease just because it has not reward, because it do not represent a significant market. Just compare it with cancers, with cardiovascular diseases, and so on. At the national level, the cystic echinococcosis and other neglected tropical diseases tend to be hidden below the radar screens of health services and politicians, just because they afflict mainly populations that are marginalized with little political voice. It's mainly a rural disease, and the marginalized society have no voice to do something about it. The diseases are generally not major killers. It's another issue. They cause chronic diseases, although frequently causing severe pain and lifelong disabilities, but they generally are not major killers in the endemic area. And finally, under resource-limited conditions, high mortality diseases such as HIV or tuberculosis are prioritized over these kind of diseases. And at the community level, echinococcosis, leishmaniasis, and other parasitic diseases are sometimes the source of strong social stigma and prejudice. So as a result, these diseases are often out of sight and poorly documented and mentioned, and this is the worsen the situation. Another cause of the neglect is the overlapping situation of neglected zoonotic diseases. For example, cystic echinococcosis. They are somewhere in between medical and veterinary discipline. Overlapping situations regarding control between veterinary responsibility and medical needs is a serious issue. NZDs affect both humans and animals, and intervention required concerted action between veterinary, livestock, and human health sector. And this is very difficult to organize. And that's why the control programs will not be well organized in the endemic areas. Generating indecision. This generate indecision as to which sector should take responsibility of the disease. Veterinary system, agriculture system, or public health system. And the disease and the people stranded between these sectors among public health, veterinary, agricultural sectors. So if you see the main driving forces influencing CE transmission, there are a multitude of factors, multitude of institutions involved in the disease control. Medical and veterinary schools, community health centers, public and private hospitals, registry and surveillance system, national and local media, continuous medical education for healthcare professionals, National Veterinary Organization in endemic areas, Ministry of Agriculture, Department of Environment, abattoirs, municipalities, geographic information systems, and Ministry of Health, local and provincial authorities, municipalities, and others. You see, concerted action among all these is very, very hard. That's why the control has not happened yet in the region. And the other problem is funding. If you see here, the big three infectious diseases, malaria, TB, and HIV, are on the center of funding in the central zone. And the middle zone is leishmaniasis, trypanosomiasis, dengue, trachoma, schistosomiasis. And if you see here, the outermost ring, mostly zoonotic diseases, including echinococcosis, rabies, brucellosis, anthrax, leptospirosis, cysticercosis, foodborne traumatodiasis, yellow fever, Bruley ulcer. And these zoonotic diseases got the least funds for research, for control, and this is another way of neglect. You see here the funds available for echinococcosis, for example, is the least among the other neglected zoonoses, neglected parasitic diseases. For example, rabies, trypanosomiasis, leishmaniasis, anthrax have higher funds. So as you see, echinococcosis is a super neglected disease. It's a neglected tropical disease. It's highly neglected disease. And the interesting thing is we could control these diseases at a cost-effective level. Different studies showed, for example, for echinococcosis, for every DALI, we could spend $10 to $12 to every DALI averted. So it could, the disease could be controlled with moderate investment in the public health and veterinary sector. Another look on the disease distribution, and let's have a look on the role of WHO and especially World Health Organization Eastern Mediterranean region. As you see here, you could see on the website, I got it today, it's health topics from A to Z. And if you see here, you could not find echinococcosis in the region. The disease is prevalent in all 22 countries, and you cannot find every single word of echinococcosis in this website. It's bizarre. You see, you can find here, for example, accidents, anthrax, life expectancy, leishmaniasis, Campylobacter, and no mention of this important disease in the region, echinococcosis. You could not find it. You can find Chagas disease. Chagas disease is there. You know, Chagas disease is prevalent only in the Latin American countries. And in EMRO, you can find something on Chagas, and you cannot find anything on echinococcosis. Another instance for this bizarre situation is the recent call for 2020-2021 joint EMRO-TDR small grant scheme. If you can see, no mention of echinococcosis, not a single word on this disease in the call for research in this WHO region. Malaria, tuberculosis, and leishmaniasis, and all that. 17 years ago, the World Health Organization at EMRO published official statement consisting of Agenda 8 items, main challenges in the control of zoonotic diseases in the Eastern Mediterranean region, and request the member states to ensure the establishment of an empowered national intersectoral committee charged with responsibility for coordinating and advising on surveillance and control of zoonoses, assess the national burden of zoonotic diseases, promote active community involvement, targeted public information materials. Update veterinary public health and health professional educational curricula, emphasizing on multisectoral approaches. Promote and support multidisciplinary research and cooperate in the prevention of zoonotic diseases and the exchange of information. But nothing happened since then. And even in the WHO agenda, we could not find not a single action regarding the echinococcosis. I wonder if this is a neglected disease or ignored. I refer to dictionary, and as you see here, the differences between neglect and ignore is when one neglects something, one may have forgotten about or not been aware of a critical situation for something one was supposed to take care or oversee. When one ignores something, one is actively not paying any attention on purpose. What we can do, advocacy is very important. We have to reach communities, to talk to people, talk to officials in all related disciplines, talk to patients, teach patients, and science communication is very important. Public health professionals have to be updated about the disease management and control. I want to thank to my colleagues who organized this piece of work, especially my international colleague, Dr. Samil Lahmar, Dr. Harun Ahmed, Dr. Mohannad Abdul Hamid, and my good colleague, Dr. Borhani and Dr. Fatih, and my great colleagues at the Research Center for Hydatid Disease in 3 research groups, Dr. Ibrahimipur, Dr. Afkar, Dr. Lashkarizadeh, my good friends, Mr. Nasibi, Ali Muhammadi, Ali Darakhshani, and Ms. Rawari, and all other people at the KNU Department of Parasitology and Vice Chancellor for Research and Technology, and all the PhD MSc students who are working on NTDs. Thank you for your attention, and I will hand over to you, Mariam. Thank you.
Well, thank you very much, Professor Harandi. You've given us a really fantastic introduction, overview, and also a very detailed analysis of where the challenges and the next steps for the control and the understanding of cystic echinococcosis is. So thank you so much for that. It was very interesting that you reminded us of the importance of our behaviors with animals that we often love, and also eating habits. Your data on fresh food consumption certainly is, was really enlightening. I never quite realized that that there was such a variation in our diets and so forth. And very interesting as well that you pointed out those slight inconsistencies within WHO. Although on the plus side, I have to say that the Department of NTDs, so perhaps not the regional office, but certainly at the NTDs department level, there has been a lot of highlighting of echinococcosis. I think their fact sheet was updated quite recently in March, and also a few articles published even as recently as the beginning of June about the situation in Mongolia, Kyrgyzstan, and China, and so forth. So, as you say, very important to highlight the neglect, even within international institutions. That was fantastic. So thank you so much for that, Professor.
You're welcome. I'm ready for any questions or comments or remarks from the audience.
Well, absolutely. You've had a few questions while you were giving your presentation, And perhaps we could start off with a question from our friend and colleague, Stephen Brema, works in pest control and is tuning in from Canada, if I'm not mistaken. And Stephen was asking, Professor, are there any studies on the duration of the incubation period in children? It is important to have this data to follow the size of the population that is affected.
Actually, it's a big question. Actually, no study has been done on the exact incubation period of the disease, even in the adults. So our knowledge on pediatric echinococcosis, it's not very much. We don't know. What we do know is the long incubation period, mainly more than 1 year of incubation for the disease to be symptomatic. But you know, the symptoms of the disease and the incubation period is very much dependent on the site of infection and the size of the cyst. So hepatic cysts are more or less longer incubation period, have more or less longer incubation period, and maybe the eye infection or brain cysts or endocrine system infections, cyst in the pancreas, in the parotid gland, has much lesser incubation period. But we have children patients, and for example, here in our center, in our province, we have children patients less than 1 year of old in Iran. So we don't know exactly the behavior of the parasite, and especially in the children. I hope I could highlight the answer.
Of course, absolutely. So a lot of data gaps remaining there. Another question, Professor, from Dr. Joaquin Prada, who is, I believe, joining us from the University of Surrey here in the UK. And Joaquin was asking, Professor Harandi, could you please comment on the challenges for a control program when you have nomadic or semi-nomadic populations? Could that lead to long distance spreads?
Yeah, nomadic people, cystic echinococcosis is mainly a nomadic disease, because nomadic people are living with their animals, with their dogs, and traveling around the countries, even international borders. So the disease could be transferred between the borders, between the provinces, and this is a major issue. A good control program have to be to deal with this problem. We need a well-organized surveillance system for veterinary and public health, both of them. So that's why an integrated public health and veterinary public health system are needed for the effective control of the disease in every endemic country. And this is a major challenge.
Absolutely. As in many of the neglected diseases, and that was very useful how you showed so many parallels between cystic echinococcosis and most of the NTDs. Another question, Professor, and before I state the question, just to our attendees, if you too would like to ask a question, just a reminder that this is being done through the chat function. So if you're on a desktop, I believe that would be on your right, or on a mobile device, it's below this screen. So please feel free to type in your questions and also let us know which university or organization or country you're tuning in from. It's very interesting to share that information. So back to the questions, Professor. From Ashkan Faridi. Hi, Professor Harandi. Please give us some advice on how we could control free-roaming dogs in society.
As I said before in my presentation, controlling free-roaming dogs is a multi-sectoral action. So many sectors, including the media, municipalities, people, NGOs, and public health sectors, veterinary sector, have to be involved in the concerted action towards free-roaming dog population. It's very important because we could control rabies and echinococcosis and in some degree brucellosis even by free-roaming dog population management. So it's not just for cystic echinococcosis. So under One Health approach, we could organize actions towards free-roaming dog population, but it's a complex matter. We are doing some activities here in Kerman, and we are facing some major challenges to concert different sectors involving this issue. It has ethical issues on how to manage dogs. It has executive issues and some data issues because we don't know even the dynamics of dog population in the cities, in the rural areas. So we have to do in-depth studies on dog population dynamics and organize most effective programs to control dog population.
And building on that, Professor, Amadou Jallo was saying, may I say a big thank you for the important presentation. Amadou's tuning in from the Gambia and writes, this is to let you know that Africa, and particularly the West Africa where I come from, we are at a great risk because we have a large population of stray dogs and a high level of engagement in gardening for vegetables that are usually consumed very fresh all over the country, and especially in hotels where we have tourists, which is exactly what you were highlighting in your presentation as well, Professor. So Amadou was asking, what is the best advice since the WHO seems to ignore this disease? And Amadou signs off as a WHO TDR fellow at the Royal Veterinary College here in London.
Okay, that's exactly right, and that's why recently in Europe we faced an emergent cystic echinococcosis mass of patients regarding the refugee crisis in recent years. People coming from countries in the Eastern Mediterranean to the European countries, and also tourists who back from the tropical Africa and tourist destinations in the Middle East, they got infection as well in Germany, in Italy, in France, and in Austria and other countries. So this is a travel medicine issue as well.
And perhaps a small opportunity to as well engage new partners on this angle, so travel medicine and raising the awareness in non-endemic countries of this neglected condition.
Yes, exactly.
Professor, you were mentioning some of your campaigns or activities under One Health umbrella. And as part of our attendees today, we have Dr. Francis Inangolet-Olaki. Francis is a public health veterinarian from Uganda who writes here, reminds us that he also had a publication in 2007 in the Journal of Animal Production entitled Distribution and Intensity of Echinococcus granulosus infections in the dog population of Moroto District, Uganda. So Francis, who has really enjoyed your presentation, was thanking you for this, was just wondering, he himself agrees that the One Health approach would be a very promising solution to this difficult public health problem in pastoral production systems. And you've given us some food for thought there on what you would see as applying the One Health approach to this disease. But what might be some more of your thoughts on this approach?
Excuse me, if I read the comment exactly, sorry.
Sure.
I have, sorry.
I've just put up on screen, Professor.
Yeah, I didn't understand that if I scroll down and up, you will be scrolled as well, yeah?
It doesn't change my view of the chat, so you can scroll away, no problem.
Okay.
Yeah.
I have often thought that One Health could be a promising solution to this difficult public health problem in pastoral production system. Yeah, I think the key issue is One Health. We cannot organize a program with one disease, one issue. We have to have an approach, One Health approach, and organize an orchestra of the actions between the veterinary, public health, media, and all officials and political willingness to do something about these diseases. We have to merge actions, for example, good experience, as Marian pointed out, in Mongolia, just to integrate brucellosis and cystic echinococcosis control in Mongolia. And we can see in Mongolia on WHO site recently emerged, as Marian said, and a good experience of One Health approach in Mongolia. The key issue is the political willingness and the intersectoral cooperation. It's very important. The overlapping situation is very crucial. And the disease just, as I said, is stranded between those sectors. It's very hard to manage.
Of course, absolutely. And in the same way that you saw cystic echinococcosis was omitted on some important documents at WHO EMRO, and I'm sure we can rectify this after this webinar, I hope, that these issues have been highlighted. But do you also find that within kind of the very active One Health movement, this disease also perhaps is a little bit neglected, or do you find that the One Health partnerships and ecosystems are well aware of the burden of cystic echinococcosis?
Pardon, your voice was a little bit noisy. Would you please pardon?
Yeah, sorry. I'm so sorry about that. Sorry. I was just wondering if you felt that cystic echinococcosis was sufficiently represented within One Health movements.
I don't think so. Even in One Health movement, I think major diseases like rabies and brucellosis are far more bolder than cystic echinococcosis. You know, people who actively involving in this disease are not very much in the region, all over the world. So we need to educate people, educate our students, teach and involve our people to be involved in this disease, to know about the disease, and that's why science communication is so important in this regard.
Sure.
Yeah.
Of course. Just moving on to a different topic. Two questions here, Professor, about vaccination. So first of all, Madi Borhani asks, says, firstly, thank you very much for the excellent presentation, Professor Majid. How can we control and prevent CE and EMRO countries And specifically, what about the logistics problems of the 95 vaccine? I think that's the EG95 vaccine, and particularly the price of this vaccine. And this also ties into a related question that Mehdi also asked, which was how can we use the EG95 vaccine to control and prevent CE and EMRO countries?
So we are very lucky to have a vaccine, to prevent the disease. So the control of the disease involves two main actions. One, dog dosing at regular intervals, at least 4 to 8 times a year. And the second is the livestock vaccination with EG95 vaccine. So we have the vaccine, but it's not commercialized or very poorly commercialized in the world. As far as I know, it is commercializing in China recently and in Argentina, and that's it. And we need to invest on this vaccine, which is developed by Professor Marshall Light Ohlers in the University of Melbourne in Australia. And we thank him for all his efforts in developing the vaccine. But, okay, sorry, I am concerning on the time as well.
Well, do you have time, Professor, for one or two more questions, or
Yes,
do you need to go?
I'm open.
You're open. Okay, that's brilliant. We're just coming to the end in any case of our webinar, but just to round off with one or two more questions from our attendees. So first of all, a great comment here from Shumanta Parida. Shumanta's reminding us that there are specific calls from the European Commission and EDCTP for NTD calls, which should also be tapped for echinococcosis. And also, perhaps as a reminder as well, to Amadou Diallo, who was talking to us earlier on about West Africa. If I can all remind you that a few weeks ago, we had, in fact, a webinar, an ICENTD Connect, from the team at Ascend, who are funding projects. So this would be specifically for West and Central Africa, Professor Majid. So not Eastern European region, not yet. But Amadou, perhaps this might be of interest to you and other colleagues in the region. So do look that up on our YouTube channel. There's a recording of the webinar and lots of information there. And on the subject of partnerships, Amadou was also asking, would you be prepared to work with the Gambian authorities to work on research on the disease with the involvement of the Ministry of Health and the Department of Livestock Services? So quite a lot of open invitations and suggestions there for possible partnerships.
Yeah, thank you all. And we are ready to collaborate with all colleagues interested in research and doing something about echinococcosis in the region and beyond, in Africa especially. And I would say that in Africa, I think the Afro region of WHO is much more interested in echinococcosis than Eastern Mediterranean region. It's disappointing, I think, for EMRO.
That's very interesting, and I'm sure there's a very good reason behind this, perhaps just in the way that the WHO has divided up the diseases amongst themselves. I know perhaps the perception is that this falls under the umbrella of the NTD department at Geneva, or who knows, but we will watch this space. Hopefully all these things will be readjusted.
Yeah.
So just to round off with a couple questions, Professor, here, Eran Devere is asking, just quite a specific question, but are there differences in the virulence, mainly to humans, of different genotypes of the disease?
Yes, for sure. Until to the new millennium, Echinococcosis granulosus was considered as one single species. But in recent 20-25 years, it's being clear that the parasite is actually a complex of species and genotypes with different pathogenicity and virulence. So we now have Echinococcus sensolato as a complex species, which is consisted in at least 7 species. For example, we have Echinococcus equinus, which infects donkeys and horses and other equids, and this species could not infect human. So sheep and human are pretty much resistant to this infection with this parasite, this genotype. But Echinococcus granulosus sensu stricto, or Echinococcus canadensis, or Echinococcus intermedius are those species with high infectivity to the human populations. So yeah, it's a very important issue, and one of the research gaps in the world is to clarify which genotype is perpetuated in which region. We have to know this before implementing any control program. So in recent years, many activities have been done especially in the Eastern Mediterranean region in this regard, but we need more and more data for some countries like Arabian Peninsula, from Jordan, from Lebanon, which have not any recent data about the genotypes.
Right, excellent. And kind of staying on the regional topic, Emmanuel Agunloye is asking, Tenia are prevalent in West Africa, and in any way does this mean that we are also predisposed to echinococci infestations?
The cycle in Tenias is a little bit different from echinococcosis. Echinococcosis is a parasitic disease perpetuating between dogs and sheep and other livestock, and human is mainly an accidental host for this parasite. But in Tenia solium or Tenia saginata, human is the main definitive host of the disease. So we have the adult form living in our intestine, excreting proglotid segments full of eggs throughout the feces, and perpetuating and transmitting disease to cattle and pigs. So it's the epidemiological pattern is a little bit different, because in Tenia, the human is in the center of transmission.
Interesting. Thank you very much. And so to perhaps conclude on this one question, Stephen Bramer's asking again a second question. So some societies eat dog meat, and what is the threat to such populations?
Pardon?
I'll just put the question up on screen. There we go. Some societies eat dog meat itself, and what is the threat to such populations?
Generally speaking, dog contact is a risk factor for disease. So those societies eating dog meat could be at a special risk of the disease because they have much contact with dogs. So it may be an indirect cause of disease, not directly. So nobody could be infected directly by eating dog meat. No, the parasite is not present in dog meat, but contacting with dogs could be a risk factor because the dog body is covered with eggs. So the people could be infected with dog contact.
Thank you for this clarification. I also just saw, going back to the funding and collaboration opportunities that Joaquin, who was tuning in from the University of Surrey, was reminding us that they also have a One Health European project funding a PhD in cystic echinococcosis. So if any of our attendees or perhaps any of your students, professor, might be interested in exploring this collaboration, so Joaquin's reminded us of that. Thank you so much for
Great news. Thank you, Joaquin.
Yeah.
And send an email or the link to the audience on the ISNTD website or somewhere else to be aware of the details. Thank you very much.
Yes, thank you for sharing that. That's very good news. Excellent opportunity with a really great team there at the University of Surrey. So, Professor, this, I think, brings us to the end of our webinar. I would just like to thank you for this incredibly interesting hour that we've spent with you. I'm pretty sure it's safe to say that cystic echinococcosis is slightly less neglected now that you have told us about more about this and of the challenges involved. You've had a lot of thank yous on the chat for your presentation, from Haroon Ahmed saying excellent presentation. Ali Derekshani, thank you, Professor. We've had Mohanad Abdul Hamid, thanks Majid, it is a very excellent presentation. Opeyemi Olasunkanmi, thank you for the presentation, and many, many more. I can't read them all out here, but a very grateful audience, and same here at ISNTD, Professor. We've been very thankful for your time.
Thank you all. Thank you very much for listening and for your kind attention. A special thank you to you, Marian, for organizing this talk. Thank you very much.
It's my pleasure. I always learn so much from our speaker and from our audience. So from us today, that's all. I hope we have the opportunity to meet one day, Professor, in person. And thank you for your time today, hopefully. And let's definitely keep in touch.
Thank you. Thank you all, and have a nice time.
Take care, everybody.
Goodbye, everybody.
See you next week. Bye.
Bye.